I am so excited to speak to our guest today. She's an MD in the South Carolina area. Please help me to introduce Dr. Sara Allen.
Hey, Jonathan, thank you for having me. So I am Dr. Sara Allen, founder and CEO of the Skin Clique. We are the nation's only medical practice of NPs, PAs, MDs, and DOs that provide concierge medical aesthetics in the comfort of your own home. So we provide Botox injections or neuromodulator injections, dermal fillers, medical grade skincare consultation, and chemical peels and Ultherapy.
Hi, my name is Jonathan McLean, and I'm the founder and CEO of McLean Aesthetics.
Welcome to the dark side.
Let's go. Amazing stuff. I'm so excited. I want to ask so many questions, so let's dive right into it.
Okay, I'm ready.
So, Dr. Allen, tell us, how did you get started in the aesthetic industry? Like, I know your background isn't so much in aesthetics. How did you go from one specialty to the next?
Yeah, great question. So I always knew that I wanted to learn how to do neuromodulator injections, but had always been terrified to do so. And so one day, I think as most entrepreneurs do, my boss at the time, I had asked for Christmas off, and he said, "Well, I don't know if you can have that." And I thought, well, I'm going to find something to do so that I never have to ask for Christmas off again. That was actually my trigger. But I always knew that I wanted to do neuromodulator injections. And so I went to a dermatologist in my local town and I asked her about it. And it's a procedure that's very frightening for patients. If you've never had it done, you don't know what you're going to look like. You don't know what's going to happen. And I felt very rushed and very dismissed. And I knew I never wanted a patient to feel that way again. And so I went and took some courses and learned how to do it. But I'm sure, as you find when you talk to people every day, you leave those courses with more questions than you went with. A lot of fear about the procedure that you're going to do because you really can't be adequately trained in a day or a weekend. And so I knew that I needed to further my skill set. And I was lucky enough to find a physician in Columbia, South Carolina, who was very kind to me, took me under his wing and taught me, everything I know. But I also knew that there are so many people who want to get into this field, and a lot of training programs are lacking. And I knew I never wanted another provider to feel as scared and alone as I felt in those first few weeks.
Wow, super interesting. And I love how you said it sprouted out of something that you were like frustrated with. That's your job, and you wanted to fix
Yeah.
that problem.
Yeah. And at the time, I was teaching medical residents and I taught them home visits. And so we were doing all kinds of things in people's homes. We do joint injections, trigger point injection, sterile PICC line dressing changes. And so for me, this was just a normal extension of my practice. I was very fortunate. I met with the medical board in South Carolina and walked them through exactly our model because I want to make sure that we're doing everything the right way. And our goal at the Skin Clique is if a patient says, I have someone coming over to do Botox at my home this evening, we want people to say, is it the Skin Clique? And if it's not, we want them to say, are they doing everything the right way? Do they have the appropriate med mal? Do they have the appropriate regulatory safeguards in place so that we can make sure that everybody's doing it in the right way? Our goal is to be the gold standard.
Amazing. I love that. I love that. Now let's talk about the Skin Clique. Now it's been open for
Yeah.
years now. Tell
Yeah.
us about the earlier years. What was the process starting this, and how
Yeah.
did everything go?
Yeah. Okay. Gosh. So I know because you talk to people all day. It is tough. And so I started the practice in February of 2018. For the first year, it really was just me. I had a 3-ring binder. I had a bag. I was going around and doing all the things. And then in 2019, there really became a point that I needed to grow or stop. It had caught on like wildfire in my small town in South Carolina. So I knew there was a need for this. And um, and I decided to grow with the help of my husband. He was very kind and supportive to me. But I was driving, 5 hours away to go take care of patients. And then I would go back for follow up because I always want our patients to have appropriate follow up. And so I brought on our first nurse practitioner very shortly after our first PA. And then we decided we wanted to expand geographically. And so we went to Charleston, South Carolina. That was our first town. But as you had to file for an LLC. You got to get medical malpractice on your own. I'd never done any of that. I learned how to code a website. I learned how to build consent forms in the EMR, right? Because I'd never drafted a consent form on my own. Never built a schedule in an EMR because as a provider, you're spoiled in your hospital job. And so all of those were fun challenges looking back that have really prepared me to be able to continue to grow, I think.
Nice, nice. So for anybody, because that's a lot of work, and I could see like a lot of people getting
Yeah.
discouraged, especially with all the
Yeah.
thrown at them at once. What
Yeah.
could be some advice that you can give to somebody that's looking to start their own company right now?
Yeah, gosh. Do your research. I tell people every day, you can find anything on Google. So, I mean, we all can, right? And you can figure it out, but you got to be resourceful and you got to want it. And so I always tell people that be ready to work hard, but be ready to enjoy the process. And if you're open to it, it'll push you. I know you feel this. It'll push you in ways you never thought possible.
Yeah, perseverance is amazing. What you can do when you have,
Yeah,
yeah, relentless for sure,
yeah.
for sure.
And the other thing that I appreciate that you do is you match people with practices, right? Because I think a lot of people, and I know you see this, are getting into the aesthetics industry because they think there's a lot of money to be made. And I will say, for the first 2 years, we were not profitable, barely profitable, right? And so you got to buckle up and you got to be ready for that because it's a lot of hard work. You don't see payoff. And then I think so many of us in medicine are not necessarily business smart. And so it's very easy to get in over your head with all of the people that you have coming at you to sell you devices and to purchase all of these things. And they make you feel like you need the latest, greatest thing. At the end of the day, you need to take great care of your patients. And if you take better care of your patients than anybody else, people are going to keep coming back to you. It's not about the bells and the whistles. It's about how much do you love people? Do you care about your patient's outcome more than they do? You're always going to be successful.
I cannot agree with that more, that 100%, 100%. Like I know practice owners that only do Botox and filler and they make
Right.
so much. And I know people that have every,
Hugely successful.
so yeah, couldn't agree with you more, 100%. What are the
Yeah.
services that you offer at the Skin Clique?
Yeah. So our services, okay. So neuromodulator, dermal filler, medical grade skincare sales, chemical peels, and Ultherapy because I myself love Ultherapy. I do it every year on my birthday. And so I used to refer so many patients out for that. And it's portable and our machine has its own separate insurance policy and all kinds of things. It's funny. So
Super cool, super cool. Do you do your own injectables?
I do. I don't do my own filler. I can't do it. But usually there's no one near me that can do my own neuromodulator. So I remember there was a movement. Do you remember this a few years ago? And people were putting up on Instagram, never inject yourself and all this. I was like, well, I'm never going to put a video up about it, but who else is going to do it? So um, my nurse practitioner, Caitlin Stone, she's my VP clinical services. She does my filler.
Amazing, amazing. Yeah, it's 50
Yeah.
50. I find some providers do, some don't. But yeah, I can definitely understand that.
Yeah.
Now, I wanted to go back into talent because I know you spoke about that a little bit
Okay.
more.
Yeah.
What is some things that you look for when you're hiring for great talent?
Gosh. Um, so for us, we're a little different, I would say. And I love getting the opportunity to talk to you because I think between the two of us, I would love to know how many people we've actually recruited for aesthetics. Um, So for us, it really is somebody who's a self-starter because our providers have so much autonomy. It's someone who can multitask very well and handle all the things. Um, we we look for people who have, I love to say, half right brain, half left brain. They're very artistic, but they also know what it takes to be methodical and cross their T's and dot their I's. Um, and we look for people obviously who embody our core values. So core values are very important to us at the Skin Clique. And so we try to interview based on those. And I'm sure you do that for every practice that you interview for.
Yeah, I find it majority after the experience, obviously the technical skills, it's really about personality fit and kind of like
Yeah,
who matches and misses the best. Because if it's not a good cultural fit, like you said,
right,
the values are not aligned. I don't care how experienced someone is, it's gonna separate one way or the other there.
right, right. And it sets you both up for failure. And then that's frustrating on both parts. And so it's very interesting to me how many people want to get into this aspect of medicine.
Mhm.
And I think it's our duty, to help people find training in the right way, to find a practice fit in the right way. Because as I mentioned to you before, we're not right for everybody, and everybody's not right for us, but there is a place for you somewhere. And so I think that's why I so appreciate what you do because you help people find the right place for them.
Thank you so much. Thank you. Thank you a lot. So let's talk about social media. It has been such an impact, I feel like, for almost everyone.
Yes.
How has it
Oh,
impacted you and kind of grow your business?
yeah. So I'm terrible at social media, as you will see if you ever look at my profile. Um, so we have worked steadily to grow our organization following, I'll say, and have done very well at that. We do have a social media coordinator. She's wonderful. Um, but I recognize how necessary it is. My co-founder, Claire O'Brien, loves TikTok. And so Claire sees, we are directly seeing a correlation with our activity on TikTok and our skincare sales. It's been very interesting. Yeah. Now, not to say that I'm not afraid of the algorithm and all the other stuff that's happening, because I saw that on the news this past weekend, but regardless, um, we find I ascribe to the belief that a lot of people find out about awareness about injectables on Instagram and things like that, but I'm not sure that they find their actual provider that way. I think they find awareness about the procedures, about what we do. Um, and I think they purchase skincare as a result of it. But I think to actually find their provider, it's typically someone that they have a connection with. I don't know if you agree with that.
Yeah, I think it is something that they relate with. I feel as though like this industry
Yeah.
is a lot about like who you are as a person. That's why I want to go get my injection
Yes.
done by.
Right. Right. It's interesting. Yeah.
Mhm. Do you share any of your personal life on Instagram, or how do you feel about that balance?
I know I should because I know that that helps your patients connect with you more.
Yeah.
Um, I have always subscribed to the belief that nobody cares what I'm doing, so it's very odd. It's very awkward to me. But I know that that is an area that I try to push myself in. And one of the best things that I did for myself this year, which is a funny thing, I signed up for master class. Have you ever done that?
I have that too, also. Yeah.
Yes. Okay. Well, I know this is a shameless plug, but I very much enjoyed Chris Jenner's Building Your Personal Brand. I don't know if you watched that one.
Yep, I watched that
And
one.
it was great. And so she talks about, making your mood board and making your board of what you want to portray in the world. And I thought that was so helpful. And that was a personal goal of mine that I don't share as much as I should, but I know I probably should.
Yeah, no, I agree. Sharing definitely helps people because people want to be along with you on the journey. They want to see where you
Yeah,
started, where you're going, how you finish, things of that nature. And
always. Yeah.
yeah, and I love that masterclass too, also because it's like continuous education, continuous learning. Always learning
Yes.
yourself on the newest things.
Yes.
How do you guys do continuous education in your company? Always do you provide that, or like tell me how important that is?
Yeah, great question. So I'm an educator at heart. As I mentioned, I used to teach residents, and so we have developed our own training program from start to finish, and we provide CME credits. We have enduring material, which is recorded, and then we have obviously hands-on live activities. And then after a provider leaves training with us, if they still are not confident in their skills, or we are not confident in their skills, then we will continue to work with them to get them to a place that they need to be so that they are safe for their patients. I'm sure you're familiar with, so the ACGME, which is the accrediting body for graduate medical education, created core competencies that they want every resident in America to show, right? And they call it milestones. So we actually developed an evaluation process, which is based on milestones that plastic surgery residents are required to complete for non-invasive procedures before they finish their residency. Okay, that really is all just to say that is how we evaluate people at the end of training. So they receive an evaluation and they're able to have one piece of actionable feedback that they can incorporate to make them a better injector. And then once our providers complete a certain number of non-invasive procedures, they're eligible to apply to be considered for dermal filler training. And we also have an entire dermal filler curriculum that goes from 101 to 301. 301 is body biostimulators. 101 is very basic, zygomatic arch, things like that.
Hey, super cool. It's like a dream for a new injector for sure.
Oh, good. I'm glad.
Sure. Is it
Yeah.
important to have like a global perspective of aesthetics?
Yes. Yeah, for sure. I am lucky enough. I just got to go to the MERS Aesthetic Expert Summit in Vienna, and there were 400 people from all over the world. It was super cool. And I got to see what people in Brazil and Europe are doing with neuromodulators and fillers, and just to see the innovation that is occurring in this field globally is mind blowing. And I think right now we're seeing, the development of techniques that are going to um, change our industry and the way that patients think about ongoing maintenance. I talk to my patients now about maintenance of their aesthetic care in a totally different way. And I think that's so important moving forward because patients really can potentially forego a facelift in the future if they continue their maintenance now or surgical tweaks that they may have had previously.
Wow, that's amazing. That's really amazing, actually. Because
Mhm.
like when you get sometimes they're like, oh, we can't, injectables isn't gonna fix this. You have to go get a facelift. So to
Yeah.
prevent that type of hardcore surgery is gonna be revolutionary.
Yeah. I mean, and think about it, right? So, yes, I have patients now who I see that are 50 plus, 55 plus that really do need a facelift, but they didn't start neuromodulators when they were 20. They didn't start dermal fillers when they were 30, right? And so we have all these things that we didn't have when they were younger. Ultherapy every year on your birthday. So, they didn't have all of these things that might put that off a little bit longer. So
Nice, nice.
it's an exciting time. Yeah.
Now, one of the biggest things I've been seeing in the news lately is really about body dysmorphia in the aesthetic industry.
Yeah.
And I wanted to talk to you
Mhm.
about that and kind of how do you kind of address that when you're seeing that in one of your patients?
Yeah, so I feel very fortunate. I don't know if it's because we go into our patients' homes or if they really do receive access to us pretty much 24/7. I don't know if it's the relationship that we develop with them, but often I find um, they are so willing to share what is going on. And I also feel much more comfortable approaching with them. So if I go see them and they say, I want filler, and I look at them and I'm like, you don't need any more filler. It's much easier to sit down with them and say, tell me what's really going on in your life. How's your family? how's your marriage maybe, which is a very personal question, but I think to drill down into the insecurity that I think drives a lot of body dysmorphia, and to be able to help patients in that way is so wonderful. And my favorite thing to do is say no, right? So patients have to convince me in a way, or I need to have my aesthetic eye needs to be convinced in a way to know that it will benefit them. Because if it's not going to, at the end of the day, what are we doing? And your patients are your calling card. They walk around every day as an example of you and your work. And so we often tell our patients, find an injector that looks like you want to look, because that's what you're going to end up looking like, probably.
I can agree with that. I can agree with that 100%, 100%. What are some white glove service things that all providers can do to kind of enhance the patient experience?
Yeah, that's also a great question. Follow-up, I think, is key. You know, there are a lot of new statistics coming out about practices need to be looking at what's your one and done rate. If you have a patient that comes in once and they don't come back, how good a job are you doing at taking care of your patients? And so I think follow-up is essential to keeping our patients engaged, happy. And no, not everybody's going to be happy, right? But I also think the best white glove thing you can do is care more about your patient's outcome than anybody else, because when you do that, that sets you apart. And I think all of us got into medicine, to help people. And in this part of medicine, we just have the wonderful responsibility of helping people feel more confident so that they can do better in their daily life. They can get a promotion. They can have confidence to take care of their family better. There are all kinds of things that we can do. And yes, of course, drip campaigns, marketing campaigns, email campaigns, sure, right? All of that, yes. But it also boils down to, I believe, to your heart and the care that you take care of patients.
Yeah, definitely, for sure, for sure. Now, with being the CEO of your own company, having your
Yes.
family, all this stuff, I'm sure you can experience some type of burnout. What are some things that you do to kind of release that stress?
That's a great question. Okay, that's been a personal goal of mine this year is really gaining perspective. You know what's so funny? I don't know if you felt this, but over the Thanksgiving holiday, I took 4 days and I did not look at anything, which is not like me. Like usually I work in the car when we're driving somewhere. I work all the time on a plane. I'm never on a plane that I'm not working. And I took 4 days. And when I came back, I noticed not everything stressed me out as much. I was able to deal with difficult situations in a more level-headed manner. And I know most people listening are like, well, duh, that makes sense. But y'all, sometimes when you're in it, you got to step away from it to get that perspective. And so I would say that's very important. If I ever have a really particularly difficult day, particularly as I know you felt many times before with um, people operations, I guess I'll say, yes. I just take, 15, 30 minutes and I go play with my girls. That gets me back. It gives me perspective to really say, okay, this is what's important in life. And how can I help this person at work to do the best of their ability so they can do the best job that they can?
Yeah, no, I agree 100%. Really bringing yourself back and taking that time away helps so much,
Yeah.
so much.
Yeah.
Listen to any podcasts or anything?
Oh, I do. I love How I Built This. One of my favorites. I listen to a lot of books. So I listen to, I would have to pull up my Audible for you, but I listen to them on 2X. And so I'm always listening and doing something. Um, that's what I would say right now. And then right now every time I'm in the car, I have on master class. So,
Oh,
oh yeah, I pull it up and I just drive. Yeah.
nice, nice. That's amazing. That's amazing. Now, education is definitely very important. Is there anything you can
Yeah.
suggest to the audience to kind of get continuous education? I know you provide it for your employees, but some people that
Yeah. Yeah, this is a great question. I think something that we're struggling with in our industry, right, is um, when we first started as a practice owner, I felt like I needed to provide that education at no cost for my providers. Because if you were in a medical practice, you wouldn't have to pay for that training, right? Obviously, that's not sustainable. And what I have found being in this more and more is a lot of, particularly NPs and PAs, are paying for their own education. And they are spending thousands and thousands and thousands of dollars a year because to take a class from a celebrity injector that may or may not practice evidence-based medicine, it is really an interesting aspect of medicine to me. So I tell you, the best conference I went to this year was Scale Music City in Nashville. It's like a $499 fee. You get CME. It's a 3-4 day conference. It was fabulous. And I can't recommend things like that enough, not only to grow your community, but also grow knowledge, evidence-based medicine within aesthetics. And then also, let me think what else I love for education. It's hard. I mean, I know you know it's hard.
Yeah, 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 for sure. Because especially when you're new, like you said, I think previously in the interview, you're taking these 1-2 days courses, and they really don't prepare you to go out into the workforce.
Right,
So it's really
right.
tricky to, in the beginning to get into the industry, I would say.
I would agree with that. And I think, that seems unfair in and of itself to have to pay X amount of dollars just to train, just to, to have even anybody look at you. And then often after you train, they won't even give you a job because you don't have experience. And so it's an interesting dichotomy to me. I find, as I told you before, it's such a joyful part of medicine that I and I truly believe in providers being able to set their own schedule. I mean, provider autonomy in your workday is the number one reason for satisfaction for healthcare providers, and control over your own day. And so I tell people I won't stop until every provider who wants that opportunity has it.
I love that. I love how you put that because when you look at kind of the demographics of a lot of aesthetic injectors right now, they have families, they have the next level in their life. So they need that. I can work these
Yeah,
days, I can't work these days. Like they need
right. And I think too, that's part of why they want to do it, right? I do think, I'm sure you saw this after the pandemic. The pandemic was particularly difficult for me. I lost a lot of patients. But I think that I loved aesthetics at its core. And then after a while, you saw a lot of people who really just wanted out of the hospital. They wanted something, I know you saw it, where they didn't have to work on nights and weekends is how they perceived it. And those people may not have been the best fit for this aspect of medicine because they didn't love it. They didn't have the artistic eye. I think that's a lot where MD Codes comes in, if I'm quite honest with you. I'm sure you've seen MD Codes and Allergan, Mauricio de Mayo, and nothing against that, right? There's a place for that, but it is a very prescribed technique for injecting patients. And I believe that that is because um, those providers don't have the artistic eye that it can take to give your patient a beautiful outcome. So they need a more prescribed regimen to do so. And it takes all kinds, but just a side note.
yes, for sure, for sure. And one of my last questions is, where do you think the aesthetic industry is headed towards, and what do you see for the future?
Yeah, gosh, I know you know. I mean, this industry has continued to expect to boom. You see it everywhere. In the US, correct me if I'm wrong, is it expected to be over a oh, I'm gonna mess this up, not 30 billion by 2030 is higher.
I don't
The
know the
global aesthetic
number,
market
but
is over 100 billion. Yeah, global aesthetic. I think in the US, maybe what, 30 to 50, depends on where you look. Um, and so that tells me that this is not slowing down, but we do have an obligation as healthcare providers to do this in an ethically and safe way for our patients. And if we're not careful, we very well could have a situation like the UK or Australia where non-licensed providers are injecting. And so I think it's important that we all make sure that we're receiving the appropriate training and education that we need to be able to provide the care to our patients that they deserve.
Amazing, amazing. Yes, that's why I believe that too, 100%. Well,
Yeah.
thank you, Dr. Allen, so much for sitting down with me and speaking
Thank
more.
you.
Tell everybody where they can find you.
Oh gosh, okay. Across all platforms, I'm Sara L with an L, Allen, MD. And then the Skin Clique is much more interesting to follow than me. And so that's just at the Skin Clique across all platforms. So thank you.
Thank you, and until next time, bye.
Yeah, thank you.